It's the map that defines England right now, what tier its inhabitants live in. We know the tiers could change, but it will almost certainly be a vaccine that will finally get rid of them for good. So what needs to happen for the vaccine to do its job? First, it needs to be licensed by the regulator to make sure it's not only effective, but safe to use.
Regulators will demand at least 2 months, if not 4 months follow-up to be sure that the vaccine does not have adverse events occurring at a rate of, say, 1 in 5,000 vaccinated that are serious. We really don't want to have that. Most of those sort of serious adverse effects will occur in the first 2 months.
But monitoring vaccines doesn't stop once they've been approved for use. Sometimes a side effect might be so rare, many tens of thousands of people will need to have had a jab for it to become apparent. More trials and big databases will allow further follow-up to happen.
We actually try and calculate what your risks are of having the disease over, let us say, the next year, and compare those with the risks of having, let us say, a vaccine-induced adverse effect. And we make sure that that balance is extremely favourable, because we aren't treating people for a disease with this vaccine, and we are treating people who are otherwise healthy.
We've heard much about herd immunity throughout the course of the pandemic, the need to stop the spread, but who gets it in the UK in the first instance is a matter of protection.
In reality, many of the programs that we use for vaccines have a much broader perspective and are really about trying to protect the entire population by reducing circulation of the infection. But in this case, in the first instance, things are being very much targeted at people who are either at very high risk of exposure to the virus through their occupational pastimes and so on, or people who we know are very likely to get very sick or die if they get the infection.
Once the vaccine has been approved, there's the task of giving it to all those who need it. The vaccine may roll off the production line, but it will take thousands of extra hours' work for GPs. Could administering it leave some surgeries out of pocket?
Even though, as I understand it, the box that it comes in can be stored in a normal fridge, I think you will find that there will be problems in taking it out, defrosting it, and it probably be one that will be for the larger centres, and hopefully the ones that we'll be getting will be the Oxford one, which is much more stable, can be stored in a normal fridge. The highest risk group, of course, are those in care homes, and what we will be doing is making sure, rather than one GP go into one care home and only immunise their own patients, one GP or nurse or pharmacist will go in and immunise everybody in the care home on behalf of everybody else.
Finally, with such fast development, will people hesitate before having it? Remember this.
I think the mum test is very important here. My mum is 78, she'll be 79 shortly, and I've already said to her, Mum, make sure when you're called you're ready.
Some experts say that we need to give more detail than what's included on a press release, and asking if it'll pass the mum test. This should include what it is and isn't known, so what harms have been reported and by whom, plus the effectiveness in different groups, the impact on transmission and longer-term immunity.
Because the programme is targeted, as I said, to people at particularly high risk, the majority of those people are going to be particularly keen to receive immunisation once the vaccine's been properly licensed and authorised, because the balance of risk and benefit is clearly very strongly in favour of receiving the vaccine.
This actually contains the vaccine, does it?
The PM was visiting a vaccine manufacturer today. The vaccine itself is within touching distance, but making a success of it will take a while longer.
Well, we're joined now by Paulette Hamilton, the Labour councillor and cabinet member For Health on Birmingham City Council, Major General Tim Cross, a retired British Army officer and military logistics expert, and James Johnson, who was Theresa May's pollster in number 10 Downing Street. Very nice to have you all. And Major General Tim Cross, I'm going to start with you if I can. In terms of the military logistics, do we have the capacity to roll this out now? And what is it? How does it work?
Well, we don't have it in the military logistics system. I mean, the nation as a whole has the capacity. The logistics is about getting the right stuff to the right place at the right time. And the trick is to ensure that you have the command and control in place to ensure that the capacity we've got is used effectively and coherently to deliver the plan, whatever the plan is. The military part of this is part of what's been legislated for many, many years. It's called military assistance to the civil authority. The military are not in charge of this. We're here to support the government and the local governments in the plan. We will put people into their headquarters, into their various command cells to help them work their way through what that plan might look like. And we will put assets out and about to help deliver, the vaccination wherever it needs to go. So but alone, the military is not in a position to do this. We don't have sufficient assets of our own. We have to work alongside the NHS and all the other providers.
I'm guessing a lot of people will be looking at the problems that we've seen over the last year, the problems that the government's had with test and trace or with PPE procurement at the beginning. What do you need, or what does the Army, I should say, need to get this right and to make it work? What's the most useful thing you can get from government?
Well, it's not just the Army, I should stress. It's the military as a whole, the Navy and the Air Force, and indeed some civilians too within the MOD. I mean, this is all, I stress what I've said before. It's about command and control. It's about the ability to think through getting the stuff to where it needs to go, to the care homes, to the GP surgeries, or to any other outlet. I mean, every village has a parish church, whatever facility we want to use to deliver it. So it's about command and control and an efficient communication system to the distribution of the vaccine wherever it needs to go.
Right.
The military, as I say, are in support here. We're not here to take the thing over. We're here to support those who would. I mean, I had my flu jab a couple of months ago. There is a system in place. We just need to look at that and decide what needs to happen in terms of ramping up to get it to, get the vaccine to the various places in a timely way.
Because it's a whole different scale, isn't it? If I go to
it's a vastly different scale.
Paulette Hamilton, where you are, how nervous are you there about take-up? Do you sense, is there an appetite for the vaccine?
Can I be honest with you, Emily? There is something in the community regarding conspiracy theories. People feel very nervous. They're nervous at the speed at which this vaccine has come to the market. They're nervous because many people think that there is a chip in the vaccine that will be put into them. They're nervous because we as a community, we have been disproportionately affected by COVID-19. And I've had people come to my ward meetings and different things saying, why are Black people going to be at the front of the queue? And that's just not the case. So I've been saying, and I've said all along, and I'll say on here, government has to be absolutely clear on the messages that are going out. And I hear what the Sergeant Major says, but people will not take this vaccine if people do not believe it's being given for the right reasons. Ever since Dominic Cummings went out and broke the rules, in parts of the community, some people feel that there is one rule for some and another rule for others. So we have to be absolutely clear, read this virus. To the groups we're giving, we need the messages to be clear, and we need the people that are giving these vaccines to be absolutely all singing from the same hymnal. Because as the man said in your intro, has it got the mom's test? And I'm not sure it's got that at the moment across the nation.
Paulette, what do you say personally? I mean, are people coming to you and saying, why are we being singled out in the Black or Asian community to go first? Do you explain it's because they're vulnerable, not because, you know, their sense that they're guinea pigs?
I absolutely do. And my word to people out there in Birmingham, we've done a lot of work in this area. And what I've always said to people is, it is the most vulnerable groups. It's not about your colour. It's about the most vulnerable groups. But what you have to understand is at the beginning of this particular pandemic, they had said that the Black and Asian community were disproportionately affected. So they truly believe that because they were disproportionately affected at the beginning, that they're being used as the guinea pigs now.
Gosh, James Johnson, I wonder what the government does to correct that narrative. And I mean, we don't know how widespread that is, but certainly Paulette Hamilton's talking as a Labour councillor in part of Birmingham City Council. What's the government's first job then, just to make sure people feel it's safe?
Yeah, I think exactly. I mean, in relative terms to other countries, uptake in the UK is looking relatively healthy. About 65% of people in a poll that we conducted through KEC CNC say they're likely or definitely would take it. Now, that's higher than the other 5 countries in that poll, higher than France, higher in the United States, and it's particularly high amongst over 65s. That's the good news, but as Paul references there, you know, we do see people saying by quite a large margin, by about 54%, saying that they worried it's been rushed through. And we also see a small margin saying that it might not have been tested thoroughly. So there are those concerns about safety. I think the government really has to get on the front foot and deflect some of those negatives. I think it has to be really honest, really clear. That clarity of message is very important, and being proactive and deflecting those things. The thing that worries me most is not necessarily the conspiracy theory side, though that is important, but is a sort of a general doubt rippling through the population that somehow this isn't safe. You know, one story getting blown up, concerns about side effects, for example. So the government has to be really clear in that. And they also need to talk about the positives, you know, promote the positives of this vaccine. We've seen today, you know, sort of referring to, you know, restaurants, cinemas, banning people from going in. That's important. That's the stick. But they also need the carrot, the sort of, what does this actually mean for you? What will this allow you to do? What will this allow us to do as a country? And really get that positive message across too.
Yeah, and Paulette, we started the show. I mean, you mentioned the mum test. We started the show with an old picture of Elvis, who was the role model at one time for polio. Is there a role model this time? Would you like to see politicians themselves having it for your community? Is it good to have the military on hand? Is that a reassurance? I mean, in what sense? What would bring people round to sort of believing that this is the right thing to do?
Can I be honest with you? I'm in a community where 84% of the community that I'm a councillor in, they're from the Black and minority ethnic groups. And if you put the police or the military in front of them, there is a level of distrust. So I don't truly believe that would necessarily work in areas such as mine. But what I do believe will work, and that's what we are doing in Birmingham, is we have something going on called COVID champions. And these are people that they know the local community, and they're going out there and they're spreading the word in the local community. WhatsApp is very popular in Birmingham. We absolutely use our faith groups that are without them, we couldn't have got this far. They have been absolutely phenomenal.
That's
but
really
we do social media quite a lot. So Facebook Live, Instagram Live, we're on Twitter. But what we also do is we get things out in different languages because people are not hard to reach. The issue here is that people are not making the effort to reach those groups. Right. So for me, the police would not be, or the military would not be the entity I would want to use to get the messages out there. But the faith groups and others would be far more advantageous in communities like mine.
Let me just ask Major General Tim Cross that you've made it very clear that the army aren't taking over here. They're just doing the logistics on the ground where it's needed. Do you have a concern when you hear what Pauline says that your people could be a sort of a blockade in a way, a suspicion of authority in some of these communities.
Well, I hear that, but I have to say that a huge percentage of the soldiers that I worked with over 30, 40 years came from exactly the sort of communities that Pauline is talking about. I mean, this is a matter of leadership. So, for example, when I was in the first Gulf campaign and we had to have all sorts of weird and wonderful things jabbed into our arms and tablets taken and so forth, because we were worried about chemical warfare, it was the senior officers and the officers who took this stuff first alongside the soldiers and, you know, showed them that that we were all part of the same team. Now, if Pauline thinks that she doesn't want the police and the military in there, she's the lady on the ground. She would understand it. She's talked about the faith communities, which I would endorse. It's the leadership. So it's people like her who need to appear in the media, on WhatsApp, on all this other stuff, being shown taking this inoculation.
It's interesting,
and
isn't
all
it?
the other leadership in terms of the politicians and the local community leaders and so forth. It doesn't matter whether it's military or police or civil, but it has to. It's a leadership issue.
Yeah, it's very interesting. James, I wonder if you're recalling the hoo-ha there was with Tony Blair over the MMR jab. He did give it to his youngest son, but from what I recall, he never went public about it. And there was some sense that if he'd only done that and been a bit more vocal about it, he would have brought a lot of people with. So is this a top-down? I mean, it's interesting, isn't it? Paulette's talking very much of sort of, you know, grassroots, and it's the local leaders and it's the religious leaders and it's social media. And Tim Cross is talking about getting the leaders, you know, in a position where others are able to follow. What is it for you?
Yeah, well, I mean, as with any sort of, you know, communications campaign like this, the key thing is, you know, realising who the audience is and, you know, what sources they trust and who they look to for guidance. So absolutely, you know, for communities, as Paulette's talking about, you know, community leaders and so on, very important. Politicians, potentially important for some people, seeing them sort of take the lead, though obviously that would need to match the sort of, you know, order of preference for the vaccine. But other institutions and things that people trust, well, the NHS and nurses, I think, you know, and not nurses and doctors, people in the profession, I think, you know, TV ads really, you know, with NHS nurses and doctors saying, you know, take this for us, do it for us, that would certainly generate support amongst the public. I think there probably is a role for celebrities, but there's also a role for experts as well. I mean, in the polling that we've done, we looked at all the different scenarios that would most boost uptake for the vaccine in the UK. And actually, despite some negative press recently, it's actually the vaccine being backed by the World Health Organization that really drives up support. So people are looking for that guidance and that sort of backing from expert bodies as well that may be contested in the sort of commentariat bubble, but to the average person on the street, a vaccine being backed by the World Health Organization sounds pretty convincing.